Good morning, everyone. Yeah, we've been to the moon, and now we're going to go to Mars. And that entails some significant challenges, one of those being radiation. How do we mitigate the effects of being out there in space without the protection of the Van Allen field? Who would imagine that you could actually see biostress induced by radiation by looking at the blood glucose levels of a human being? Well, decades of experience in this country and around the world has shown that radiation cancer therapy has caused significant effects in people that are sensitive to radiation. Hyperglycemia, high blood sugar levels. Who would have thought that? Well, my journey, my mission, if you will, started 3 years ago. One uneventful Sunday morning, I was sleeping and I woke up early and I noticed that my wife, Susan, who was a nurse at the time, wasn't taking advantage of her Sunday to sleep in late. And I was kind of curious, so I called out her name and there was no response. And I was kind of concerned. And so I got up and I walked over to the living room. And she's sitting on the couch, staring into space. And I go, "Hey, Sue, good morning." It's just no effect. And I'm realizing, oh my gosh, she's a diabetic. And she's having a low blood sugar. I better do something. So I go over to the refrigerator and I get some orange juice. And I bring it to her. And I say, "Here, drink this." She drinks it. 15 minutes, she go by and all of a sudden she goes, "Mark, where am I? Where am I?" I said, "Sue, you're at home. You're okay. You just had low blood sugar and you're fine." Well, that really rattled my cage. My dad died from diabetes. So did my uncle, his brother. But it never had hit me like this before because I wasn't responsible for them. I was responsible for her. I used to be the director of engineering for Stanford Research Institute of Marine and Space Technology. And I worked on really difficult projects for DARPA, for Special Operations Command. I developed sensor systems for littoral environments, seawater, to look for things that we want to know are there before they surprise us. Little did I ever imagine that the technologies we developed for electromagnetic sensing in seawater could be applied to solve a problem that we have not been able to solve for 40 years. This is my gorgeous wife of 36 years, and she's my best test subject. Unfortunately, she still has blood sugars that go over 300 milligrams per deciliter. There's her with our first device, which worked very well, and with our new device that we're going to Cleveland Clinic with in the next few weeks. If I would have slept a couple hours longer, she wouldn't be here today. I wanted to have a system that would alert me when she had the situation happen again so that I could do something about it, that I wouldn't be driven by fate of whether or not I would be able to be there for her. That's the name of our company, Alert. G is for glucose, Y is because we need it. When I start looking into the situation around the world, I was amazed. I had no understanding that we're looking at over 420 million people that have diabetes all around the world. And the number is growing. 1/3 of us here are borderline diabetic. And the irony is I started this company to save my wife's life and others like her. And I volunteered for testing on my own device because all of my engineers are in perfect shape, a lot of them are athletes. And they couldn't get a blood sugar of over 180 milligrams per deciliter. And I said, "You know what? My dad was diabetic, so I'm probably borderline. I'm going to peg the needle for you guys." And so I had 2 Boston cream donuts. And then I had a big Coke Slurpee, and I said, "Man, I'm going to peg the needle, guys. Go ahead. test me, right? So my project manager, we were using 3 glucometers at the time because the variability between glucometers is large. We take the average. And he turns white as a sheet, looks at me, "Are you feeling okay?" And I go, "Yeah." "Why?" He says, 2 of them just say, "Hi, you're out of linear range." And the one in the middle, 650. And I go, "Oh my gosh, I'm diabetic." Was I surprised? No. But I didn't think about it, right? Because you assume you're okay, right? I had just lost 80 pounds. I thought, man, I'm really packing. I can wear my college clothes. I'm in good shape, you know. I was hyperglycemic. I was a candidate for having a stroke. I didn't know I had the disease. 9 million people in this country don't know they have diabetes. So thank you, God, because I saved my own life. The technologies out there right now are ancient. They all rely on a chemical reaction. There are 42 known interference to that reaction. So it's really not optimal, but it's the best thing we have. The continuous systems that are out there are very invasive. You have to actually put needles inside you with sensors, and you have to replace them every couple of weeks. My wife, there's no way in heck that I could do that to her, and so I said, I gotta do something about it. The solution is something that you wear, like a wristband that you don't think about, that uses an RF field, just like an MRI, to take a picture of what's inside your body. In this case, we're looking for blood glucose. Not only can we use this to look for blood glucose, but the technology can also be used to look for changes in body fluid distribution in the body, and also muscle and bone changes, losses, which are something that would be useful to have when we're on these extended missions in space. The core technology is nothing new. I'm a subject matter expert in atomic spectroscopy and molecular spectroscopy and X-ray spectroscopy, but I missed the whole part of the spectrum, RF spectroscopy. I didn't even know what that was. They call it dielectric spectroscopy. And it's really effective at looking at certain things that you can't see with anything else. This here is a model, a part of a model. We have a whole body model that's part of our software package we have that shows you how we can look at different absorptivities of RF energy by frequency. And you can see the bone is in there. We can look at bone, we can look at muscle. More importantly, for my application, for diabetes, we're looking at blood glucose. What makes this technology possible is stuff I worked on at SRI. We developed super dielectric materials to shrink the size of antennas. And in RF, that's what we use as a sensor, is the antenna, right? The frequency ranges that I'm using, you'd have to have an antenna the size of a telephone pole. I don't think any of us want to wear a telephone pole around, no matter how badly we need it. So we were able to, using this advanced technology and using metamaterials approach and through additive manufacturing, we can produce a sensor that fits into this platform. So, like I said, you see the refrigerator size unit? That's what the university's been doing for the last 20 years. I took that and made a first prototype that you could wear. It looks like Frankenstein, but it worked. The next unit is the one that we're going to be doing Cleveland Clinic validation on. And then once I get the next round of funding, we're going to go do the small wristband that everybody's going to want to wear. The data looks really good. We can compete with the SMBGs, which are the self-monitoring blood glucometers, and are much better than any continuous glucose monitor. Plus, we're not just measuring interstitial glucose, we're measuring blood. So it's real time. My wife right now is using the Abbott, and I have to constantly remind her, that sugar number that you're getting is 30 minutes old. You won't see the effect of what you're eating now for another 30 minutes. So you can't use that to really know how to manage your diabetes if you're doing anything that's physically exerting or if you're eating something. You have to wait or prick yourself and find out what it is right now. You don't have to do that with our technology. This is a demo, the first system we had.
Alertgy's non-invasive, user-friendly.
And you can see he's wearing the device. And we at that time were using 2 patches, 1 on each side. We've come down to a system now that works with 1 sensor. So all you want to do, want to know what your blood glucose is, you press your application on your phone, or you can look at the device itself, and it tells you what your blood glucose is, and it'll also show you trending as to what happened or what's happening for the last day or whatever you want to set it for.
I'll use a 20-year-old basic technology to compare Alertgy's blood glucose.
So he's going to show you what you have to do if you're a diabetic today and you don't have type 1 diabetes that qualifies you for a continuous glucose monitor. You have to prick yourself and take a measurement, which I don't know how many of you would like to do this in a restaurant because you have to do this before you eat. So it's something that most people don't do, and that's the big problem we have, is people do not want to do this. So there you go. My wife's fingertips at one time were black because of all the pricks. She gave herself 8 or 9 pricks a day. And we're getting very good correlation, real time, with the blood glucose. We're the only ones that can measure blood glucose real time, non-invasively. The best proof of everything was that Dr. John Bird, who founded XCOM, which is the first company that actually made a continuous glucose monitor, came to our lab. We tested him. He said, "My God, Mark, you figured it out." He invests in our company. He's on our board of directors. We're doing trials right now, locally at the Complete Care facility, starting Cleveland in the next few weeks. The 510K process is fairly straightforward. We don't expect to have any issues going forward with that process. As you can see, we're going from a larger device now. We're going to have the next generation device ready in about a year. The founders, all are people I've worked with for 20 years or more, worked on projects that were considered impossible in some cases, and have a background that makes it possible for us to get done what we need to get done. I have a world-class advisory board, so if I have issues or questions, I can rely on them to give me the answers. And they've really helped us out quite a bit on our amazing journey. The business model is very straightforward. We're fully scalable. We're going to license our technology from people that are already in the industry. And we're going to basically keep the analytics cloud-based system as our method of making money, long-term subscription model. And we're also going to keep the dielectric material trade secret, and that's going to be another industry in itself. Blood sugar is just one application for that technology. If you look at the marketplace, there's no one in our space right now. We've got a very unique, very, very unique position that will enable us to go forward fairly quickly once we get past the trials. We have made amazing progress. We're only in business for a couple of years, of which only 2 years have been really funded. The first year was funded on my 510K retirement plan, 401K, whatever. It's gone, but it was worth it. So, we're making really good progress. This is where we're going to go, basically. What we want to do first is finish the validation trials. Then with that data, and with Cleveland and others that we're working with, go forward and meet with the FDA, define what we need to do to get their blessing. Move forward with that. Concurrently at the same time, we take the larger device, we've already done the conceptual design for the wristband, and we start working with partners like Qualcomm to build the ASIC chip to make that possible. So by the time we get through testing with the FDA, we should have a functional product that's a wristband product. We'll get the certification with the larger device, and we have special certification real quick for the wristband device, and we move forward from there. So really, what's different about what we have is that you don't have to think about it. It measures true blood glucose, real time. It alerts you. It alerts your loved ones, whoever you program it to, if you're having an event that needs to be taken care of. When you're having low blood sugar events, you become unable to do that. So that's a real critical thing. And I think it has application for NASA to be able to monitor the astronauts in a variety of ways to make sure that we take measures to deal with the situation before it becomes something that affects their performance. And there's ways to mitigate these things. Our technology will let you do that without thinking about it. Thank you very much for your time.
If you don't mind, I'll start. I'm Kathy Lofton. I saw you in Orlando, and I really appreciate all the changes you made to your presentation because you addressed all our questions about what makes your system different. What I wanted to ask you about is right now, I understand you say when you go from the clinical trials from the larger to the smaller, what are your technical challenges there? And is that what you're looking for investment in, is how to actually go to the smaller device? You already have a plan. Can you expand on that a little bit?
Yeah, so I would say the biggest challenge we had was reducing the sensor so that it would fit behind, let's say, a woman's iWatch. And we achieved that. We have a sensor because of the dielectric materials we developed that will allow us to do it. So I think everybody realizes what's going on in the electronics industry. Miniaturization is really not difficult. I mean, that's what they do. Moore's law has been driving that forever. We don't need to go all the way down to the nano level. We can use an existing ASIC chip, put a couple of our circuit things on top of that, layer it on top of it to go forth first. It's just a matter of money. And it's not cheap to have an ASIC facility. It typically costs you millions of dollars to build a specific chip, a custom chip. I can reduce the cost and also reduce the risk by taking an existing chip that has a microprocessor and all those other things already in it. There's no need in replicating that something that's already there. Just put our special circuit layers on top of it. So the biggest challenge really was the dielectric. And then over time, the other challenge will be getting more and more data, because what we're doing is actually driven, we were using very sophisticated single extraction and single process. So, sorry, it kept going.
What are some of the other species or whatever that are impactors to the dielectric properties of the blood?
So species, other interferences, or is that?
Yeah, the other compounds.
So what's interesting is unlike optical spectroscopy, which could be molecular, like FTIR, and also just visual, the interferences that we have are not there. They're not chemical interferences. Like, in other words, you have different sugars, right? If you're talking about infrared optical techniques, the reaction of the light with those molecules is the same. So it's impossible to differentiate them. But for some God-given reason, there's a specific phenomena in the human body, in vivo, where the interaction between the red blood cell membrane and glucose causes a response that's extremely specific. And not only that, but it acts as an amplifier of the signal and allows us to pick that signal out. And there's been they've done studies in the universities with other different types of sugars, no interference at all. It's just it's one of those natural anomalies that exists. And it's incredible because one of the things about glucose in your body is it tends to attack everything. It coats everything. It's the only sugar that does that in your body. Did that answer your question?
I guess in part. I was wondering if electrolytes of other sorts, potassium, sodium, and such, could, well, the angle I'm coming at is,
sure.
Could you make this a multi-purpose device with time and additional research to also measure other compounds that might be critical to understanding astronaut health or even health?
So this was not going to do anything like electrolytes directly at the frequency ranges that we're looking at. We can look at it in other areas. What we've been focusing on is looking at differences in proteins, so muscle, and then we can see bone because it's such a large differential. So the question, it really depends on what the dielectric properties are of the substance you want to look at.
Right.
We might be able to pick up those things, but we've been focused in the other area, but I haven't really looked at it, so I'd have to say that we're looking at broadband, so we're getting a lot of information, so we can correct for some things without even knowing what they are, using machine learning and things like that. But we haven't looked at measuring things like sodium differentials. We could see the effect because we're looking at the dielectric is going to change as a function of these things in the environment. But we haven't done the studies to really get up on that.
Okay.
Mark, great job today with your presentation.
Thank you.
It's been great to watch you progress in your pitches and how you're communicating, solving the problems and needs. My question was around the commercialization process. You had a slide in there that talked about your revenue model. Can you expand on that a little bit? You went over it pretty quickly. And also, I'd have to say, I really like the fact that you're talking about licensing out the technology. I think that's incredibly intelligent. But walk me through that $100. Who's paying for that? Who's that pointed towards?
Okay, so there are actually new codes that have become available on Medicaid and the insurance companies that will pay you a certain number of dollars a month for just digital health diagnostics. So that's an obvious thing they'll pay for that already exists. The codes are there. You just have to write to them. And then the other side of it is the device, the SMBGs that are out there and the consumables are covered by insurance as well. So basically we could write to that as well. And the nice thing is we don't have consumables. You wear this thing for years. Our model originally was to have a disposable device that'd be good for a month and then replace it, right? And that $100 cost included that. So if we don't have to replace that device every month because we were using a primary battery, we want to eliminate the charging part of it. As a problem, people forget to charge the device, then you're liable because it's not working, even though they're the ones that forgot to charge it, right? So that becomes a problem of our strategic partners, how they want to address that. But really, we're looking at if we can get $20 or $30 a month for the IoT analytics support that constantly calibrates it and the alert system, that will more than cover our costs. And then our partners will make whatever profits that make sense on the hardware and the distribution and the sales. So $100 a month is what my wife was spending on consumables, doing the pricks and everything else. So we're as inexpensive as the SMBGs, much cheaper than the Dexcom system, and competitive with the Libre that they're giving away right now that Abbott is doing.
Great. And then one more question before I pass it on. With regards to wearables, compliance is always an issue. And I know that compliance is already an issue in the diabetic population. So where do you think your device will assist with compliance as far as blood sugar monitoring goes? Have you had any large conversations, large survey data, anything like that yet?
Yes. Blue Cross Blue Shield is extremely interested and is working with us as well as Ochsner Healthcare, because what health is being driven to right now is their deliverable is being able to save money, right? When I was interviewed by the Cleveland Clinic second in command, he said to me after he said, we're going to do it, he said, Mark, you realize that 1/3 of all the hospital admissions to the emergency room are due to diabetics. And he says 75% of them don't need to be there. If we could just have them be compliant and give us the data, well, now we have that. They don't have to think about it. The data automatically goes, and they can make it mandatory. Like in Japan, I talked to a couple of the health companies there. What they're going to do is they're going to have rates, just like we have with the car insurance now, where what you pay for insurance is going to be driven by your compliance. So if you want to get the lowest rate, then you're going to have to submit to this program to have the data watched continuously. So I think it's going to be really interesting to see how that works here in the United States.
I have a question. So how much are you raising and how much have you raised? Because you mentioned Dr. Bird invested in the company.
So we raised $1.2 million for the seed, and we're raising $2 million in a bridge round right now, of which I already raised $1 million. Our valuation when we started was $5 million. Now it's $25 million. All of the money I've gotten has been straight common stock, no preferred stock. I had no problems. So I just didn't want to get into convertible notes and all that stuff. And so we are debt-free. I have enough runway to last another 6 to 9 months. And I'm pretty close on closing on the other $1 million, which will give us plenty of runway. And the Series A, it'll be $10 million that we need to raise to do the miniaturization and also pay for the FDA stuff to get that through.
Okay, and my second question, you mentioned the technology you're using is not something new, but then you mentioned you have some patents. What are the patents about? On the system, on how you transfer data?
So the base technology is not new, but the ability, using the dielectric to get around skin effect and be able to make that sensor practical is totally new. And so right now we have utility patent that we've applied for and in the US, and we're going to keep the dielectric as trade secret, because without the dielectric, they can copy, I mean, they can take our thing apart and they can copy everything, but the dielectric is going to be very difficult for anyone to reproduce.
Could you elaborate on the benefits to NASA and give us some specifics as far as your vision goes?
All right, well, I mean, for instance, if I'm monitoring an astronaut, the things I want to be aware of are things that can affect their performance, their ability to do all these. They're not just sitting around playing cards, right? They have to do a lot of work while they're in that spacecraft. And they have to be able to do that work. And one of the things is that, you know, like for the guys that have the cancer radiation therapy, was that everybody has a different sensitivity to radiation. They got some guys that can handle as much radiation as a cockroach. Another guy gets an X-ray and he's nauseous, right? They can monitor how much radiation you have, but they can't monitor how it affects you as an individual, whether you are more sensitive to it or not. So what this allows us to do is to understand who's having a negative effect and then do remediative things. Like we'd say, okay, looks like your body's going nuts because you're getting too much radiation, even though everybody else is fine. We're going to put you in the room where it has the most shielding to do your tasks there, right? And so the other side of it is, I didn't realize this until we won the contract. We won the program with NASA Tech Doc at KSC. And I learned from them that one of the big problems they have with weightlessness is that the body fluids start to shift on some people, not everyone. Some people, all of a sudden the body fluid goes up to their head. And that increases the pressure, and they wind up going blind. You know, so you know, a blind astronaut, what are you going to do? And it's not reversible. But if you can identify it before it clinically manifests itself, in terms of impeding their ability to do their job, you can take proactive measures to keep them functional and avoid the problem. So really, it's knowing, and that's where I'm hoping that once this device gets out there, we can pick up other things. Like, for instance, the English uses technology to scan for mad cow disease. So, because it's more sensitive than bioassays and everything else, we don't even know what all the markers are. But over time, we have millions of people using this device. We start saying, hey, we see this really weird peak that's growing on this one side at this frequency, and we find out this guy died from a disease. Or for instance, one of the things that I think is a good application is Alzheimer's. The tau protein that's linked to that is very, very unique in terms of the dielectric properties. So we will be able to diagnose things before they're obvious clinically. We'll be able to treat people and see real time if this is really working for them or not. And we can adjust to make sure we get something that does work for them, because we're seeing what's happening and we don't have to subject them to all this testing, you know, that they get tired of. And so it really works out really well.
I have one last quick question. I think you explained your revenue model fairly well. What's your competitive environment?
It's extremely brutal. I mean, this market right now, it's like the perfect storm. You've got instrument companies, device companies now that are partnering with pharma companies. That scares me. The whole reason I started this business really is to make this available for everybody at a reasonable cost. What scares me is the brutal environment of the pharma industry and how it's driving everything. And so that's the thing. That's why I like to partner with a big medical company, because they know how to deal with that. Because a small company would have a real hard time. They would just tie us up in frivolous lawsuits. That's the big scare I have, really.
Quick question. One of the reasons that you do see a lot of collaborations between medical tech and biopharma really goes back to a question that was asked before, is data. They're looking to combine data points. Are you thinking of strategic partnerships for that? Which ones are you thinking of if you already have them? And then particularly integration with established EMR vendors. Have you been having those discussions with the Epics or the Cerners, or what's your thought process behind that?
So on the EMR stuff, Ochsner is really top notch there, and we're working with them on that side of it. On the other side of it, we are in discussions with both Dexcom and Medtronics, and then and others that are in the SMBG business already that want to have a CMG product, right? So and there's other revenues also. We have people like Sampson that want the licenses for non-medical. We showed them how you can integrate it on the Galaxy Watch. And, so there's other potential things that we can do as well.
So Oshner is going to be...
That's time, Jose. Thank you.
I'll be happy to answer the questions later if you like.
So, thank you, Mark.
Thank you.